And we excuse this interruption to breaking news now. This morning, Governor Cuomo confirmed a second case of the coronavirus in New York. A man in his 50s in Westchester has tested positive for the virus. County Executive George Latimer is holding a press conference on this newest case right now in White Plains. Let's take a listen in.
The leaders of the Westchester County Board of Legislators, the Vice Chair, Alfreda Williams, is here. The Majority Leader, Mary Jane Shimsky, is here. The Majority Whip, Chris Johnson, has joined us. And we have members Damon Marr, Catherine Borgia, Nancy Barr, Ruth Walter, and if I missed any other, do forgive, Kitley Koval and Vedat Gashi. We also have Carolyn Stevens, who is here as Chief of Staff, representing Chairman Ben Boykin, who unfortunately is out of state right now and on other business. We have other members of our executive team who are here. When we're finished with the press conference, any of the questions that we have to go through, then we're happy to have anybody in the media interview any of our guests that are here, members of the legislature, however you see fit, in order to complete your information. We're here at 12 noon on Tuesday afternoon to provide an update on the status of the coronavirus issue here in Westchester County. You heard this morning that Governor Cuomo, at his press conference in Albany, was able to provide some information on the breaking news that you're all well aware of. First of all, we want to thank Governor Cuomo and the leaders of the state legislature for approving a $40 million emergency appropriation package that will provide resources that are necessary for us in order to deal with this growing issue. We know that we're going to be required at the county level to work in direct harmony with the state, and we appreciate knowing that the financial resources are there, which are going to be critical. As the governor said in his comments, we are in uncharted territory. We know that this virus, which now has appeared to move based on issues that don't involve particular travel to a country, community spread now seems to be at hand, in which case we have a major task of detective work to find out in what place individuals were exposed to this and over what period of time, the 14-day incubation period, we have to work with in order to determine how many other people may have been exposed. The governor said today, and it's worth repeating, that 80% of the people that are exposed to this virus do not suffer symptoms, nor are they taken ill. Of the 20% that are taken ill, some are taken severely ill. And of course, we have had in Washington state fatalities, and we pray that we'll avoid that here in New York. But no one can be sure of what may happen next. And as we give you the update at this point in time, our commitment to you and to all of the elected officials, both the Board of Legislators, our state delegation, our congressional delegation, is that we will share information in as realistic a time frame as we can. It's very important for us to be precise about the things that we can share and not share. There are federal HIPAA laws that do provide a certain amount of privacy to individuals in healthcare situations. And we want to make sure that we're realistic in communicating with you, but not creating a climate of panic and fear. As I said 2 weeks ago when we had our first discussion about this, the only thing that spreads faster than the virus itself is misinformation and the fear that goes with misinformation. County government and the county health department, when you hear from Dr. Allen in a few minutes, has certain direct responsibilities, and the Board of Health as well. In fact, last year the Board of Legislators passed and I signed into law providing additional authority and power to the Board of Health and to the Commissioner to act in some of these key areas so that the professionals who are best able to address these issues are empowered to do that. We want decisions that are made in the public domain with transparency, but we also want them made by professionals who understand the medical impact of these different items. With the governor's comments this morning, he was very specific about the active case that we now have in Westchester County. In general terms, we still have, outside of this particular case and the people related to it, 12 individuals that are undergoing quarantine who are may have been exposed to the virus, and we don't know if they will develop into active cases or not. We have had as many as 26 people that have gone through quarantine, and quite some number of them have been released to go on with their regular workday, having gone through the 14-day period of quarantine to determine if they are symptomatic or if they've actually contracted the disease. There is now a testing opportunity, which just a few days ago was given to New York State, which is very helpful in this, so that we're in a position working with the state to test those individuals. We're using that in the specific case that we have coming up. And, you know, as we look forward, we intend to use that through the direction of our professional medical staff to determine whether people are or are not affected by this. We have opened our Emergency Operations Center in Hawthorne. which is a facility that brings together people from different parts of county government and from outside county government, those that are relevant to this issue, those that represent hospital, medical facilities. John Cullen is in charge of that facility, and we will be moving our operations after this press conference over there. And if there are any updates that we do, we will be doing that from Hawthorne, where we will have the ability to speak immediately with all of the relevant individuals that are involved with this situation. We're in the process of preparing a fact sheet that will talk about both the illness and some of the other facts that would be helpful. We will disseminate that widely, certain to our friends in the press, but as well to those who are interested in being updated on these things, so that they have some common sense of what the disease is and isn't, and what the progress is or isn't. But this is a dynamic environment. The numbers that I just gave you could change during the period of time that we're here together, and I think we have to be humble to understand that we're dealing with something that we haven't seen quite in this fashion. We also want to point out that we are going to have a conference call at 3 o'clock for all public officials from Westchester County. All the municipal officials are invited to be on that call. Members of the Board of Legislators are welcome to go on to that call as well, and members of our state legislative and congressional delegation as well. We will, aside from whatever information we present, we'll try to handle questions that come up, and the questions will be all over the ballpark. But our partners in government, as Mayor Bramson here, is we are in this together. We have authority as a county government through the public health responsibilities from the state, but we will try very hard not to make unilateral decisions, but to make decisions that are reasonable and in concert with local government and local government needs. We do not have authority for certain elements of things that occur within Westchester County, within our borders, but we do not have the legal authority for that. Right now, the particular patient who is now being treated in New York City was treated previously at New York Presbyterian Lawrence Hospital. It is the state health department that goes through the protocols with the management of Lawrence Hospital in Bronxville to determine what exposure might exist with the medical staff there and with anybody else that was in the Lawrence Hospital world. The state health department will deal with that issue. State health department is also going to deal with the issue of transportation. The transportation of the affected individual who serves as a lawyer in New York City, his commutation, whether that was on Metro North or whatever his transport was during a potential period of infection, and then certainly after he was symptomatic, falls within the New York State Health Department responsibility. They will track those informations down. They might inform us from time to time, but that won't be a primary responsibility we have. And the City of New York, I've spoken to the relevant officials there. They are going to track the movements of two of the children of this family, one of whom is a college student, university student in the city, and the other who attends a day school in Riverdale. That day school has been closed. That's been reported in the press already. That was a voluntary closure by the school. The New York City Department of Health will track their movements to determine whether they were in touch with other people that could be affected by this. And that's a New York City responsibility. Our responsibility, which Dr. Amler has taken on, is her department, is to track the movements of this affected individual and his family within Westchester County. And those movements may involve any number of different activities over a period of time. It will involve any interactions that they had with the House of Worship, with any other activity or event that they may have attended. In that regard, we have put at Dr. Amler and the Health Department's disposal individuals from other parts of county government who have other functions. We have nurses, trained nurses who serve the Department of Social Service under Commissioner Kevin McGuire. We have very capable detectives of the Public Safety Department. We have individuals from the Emergency Services Department, and we've asked those commissioners to look at staff and reallocate resources under Dr. Amler so that we can do the detective work that's necessary to find out exactly where these family members may have moved about and who they interacted with, so we can get a handle on how much of this spread may have occurred. The information relative to that will also go through the various institutions that these folks may have interacted with, and to that regard, the City of New Rochelle has been very forthcoming and willing to put resources under the direction of the mayor and the city manager, Chuck Strom, to help the process of determining that wherever those circumstances may be. We intend to have another press call, another public information call about 4 o'clock with religious institutions in general and those that may affect this particular case to discuss how we go about that, because the protocol of identifying everybody who may have attended a community event is even more difficult to deal with than everybody who went to class with you or who was in the same place of work as you are. And all of these things have to be tracked down. So it's going to take a lot of manpower hours to try to find that out and to try to determine where we are with people. It is only logical to say that if anybody is coming down with symptoms, flu-like symptoms, if you've had a flu shot, you all know I just got mine extremely late in the process, but if you are getting flu-like symptoms and you know that you've had a flu shot, then that should be a trigger that you might have something else and you need to consult with a medical professional. Do not go directly to an emergency room of a hospital. Do not go directly to an urgent care center. Call your healthcare professional. What might happen is you would go to a room filled with other people, and you might be in a communicative situation, and you could communicate that to, convey that to other people. And we don't want to do that. So use logical sense. Call your healthcare professional. In a second, we'll give you some numbers of Westchester County that you can call, and the state hotline. You can call those areas too, and hopefully we'll get intelligent information. We expect that we're going to be overloaded. We already are. We expect that every pharmacy, every medical group are going to get calls from people who are concerned about how this is going to play out. And not every answer, not every question can be answered in real time. What if this? What if that? What happens if these things happen? We're going to try to deal with it as intelligently as we can and as diligently as we can, as we've tried to do up to this point. But we expected, as we said the last time we were here at the microphone, that things will go from one level of alert to the next level of alert. We are not at the highest level of alert. There is no other proclamation or concern. We will look to the governor for that leadership. And at the time that we have to go to some other different level, we'll communicate that with you. We'll discuss it with our colleagues in government so that everybody will be on the same platform. We are fortunate in the county that at this moment in time our parks, our pools are not open, our beaches are not open. We don't have playland open at this point for normal purposes, so we don't have the normal spring, summer, fall combination of people getting together that you would normally have. So we have at this point made no changes in our plans for the services and the programs that the county government provides. If that changes, we'll communicate that, and that will depend on what we see out there in the real world. I do want to highlight as well that there is a state hotline that has been established. It was referenced by the state under the governor's leadership, 1-888-364-3065, 1-888-364-3065. That is the state hotline. Since you're drawing from 19 million people in the state, you may want to compete with 1 million people here in Westchester County and call locally. And we hope before the end of the day to have operational information available at our 211 information line, which we operate in concert with United Way. At this point, as we're having this conversation now, we are not fully operational on that line for this kind of information. The line is open, but someone will have detailed questions. The people who handle those calls have not been fully briefed. We intend to do that over the course of the day, and so that when people do call 211, perhaps a little bit later in the day, they will be able to get accurate information. And we appreciate that service to make it easy for people to ask the questions. We know that we're going to get a series of questions from our municipal officials and from some of the other constituent groups, and we may in fact do as many of these conference calls as is requested by any combination of people based on these circumstances. The family of the individual who is receiving medical treatment in New York City, right now, that family is quarantined in their home. We have gotten authority to test the members of that family to see whether or not they have contracted the virus. And although that the two children have attended college and high school inside the boundaries of New York City, they are now self-quarantined in their home. And of course, what we're going to try to do as best as we can is to deal with that element of quarantine as effectively as we can. As more cases develop, the quarantine function will expand. That's just a logical expectation. The county police has been very efficient in trying to help us accomplish that. And I want to single out members of the health department for going over and above to help us wherever we've had to quarantine people. We've had a site to quarantine the very first person that we thought were under observation, and it took elbow work right down to deputy commissioners and who did what they have to do. And I think that's an important thing to mention. I'm going to turn this over to Dr. Amler in a second. Then we're going to invite Mayor Bramson to say a few words. We go through in this society a debate about what is the role of government. And of course, there are different philosophies that say we should have less or more government. We've all read Thomas Jefferson's great treatises on this, and every political campaign becomes a debate about big government, small government. And there are times when it can feel that government is oppressive. Government regulates you too much. And that's a perfectly legitimate debate to have in a society. In a moment like this, you need government. You need people in government who aren't thinking about elections and politics, but people who think about an obligation that we've taken on. All the elected officials who are here with me, we've taken on an obligation. And the people behind me who serve, Noam serves in elective office, the rest in appointive office, they have accepted their responsibilities in a professional fashion. This is the time that we need to have faith and trust in government. And government, in turn, has to be worthy of that faith and trust. That we are professionals, that we have professional police, professional emergency services, professional healthcare individuals, so that individuals who might not have every question answered the way they would like to have it answered, at least understand that the state government under the direction of the governor, our county government, our partnership with local governments are doing its very best to deal with a situation that is evolving as we speak, is problematic without clear answers. Those of you in the media have a style and a strategy of how you communicate with your people. We obviously understand, what is important for you in attracting people to follow your particular medium, and we just ask you to help us in a moment of crisis, where something is more important than just the headline, as it is not something is more important than the next election. We have to show that this is what self-governance is, that reasonable people can make intelligent decisions. We can talk to each other across whatever ideological lines we have, and we will make prudent decisions to protect the public's safety. And with that, I'm going to ask Dr. Amler to tell us a little bit more about where we are medically and scientifically with this issue. Dr. Charlita Amler.
Good afternoon. So at about 1 o'clock this morning, I was notified that we had a positive case of coronavirus in Westchester County. And so what does this mean to the county, and what does this mean to the health department, and what is your health department doing for you? So as soon as we're notified, our role is to start investigating, to start interviewing every person that we can who might have information about how this person might have contracted this infection and who they might have spread it to. And so that's what we're trying to do right now. We're trying to just do this investigative phase to learn who might have been impacted and where could this have come from? Because right now, I don't have that information. So I have staff working on this, and over the course of today and over the next few days, we will be identifying individuals of concern that we will be reaching out to. Some of these people might require testing, some of them might not. We will be talking to people in regards to their health. Have they been ill? When were they around the person who is now positive? And under what circumstances? So what you can expect from us is just that we are going to continue to investigate, and certainly we will be trying to release that information to the degree that we can, and keep the public as informed as possible in regards to what they should do. But some things have not changed as a result of this recent case, and that is that we all have a responsibility to take care of ourselves. So as we've talked about before, people need to be cognizant of how they can protect their own health, because there could be cases out there that I don't know about just yet. And so how do you protect yourself? Well, we've been through this before, but it bears repeating again. Hand washing is the #1 thing that I can tell you. It is the most important thing that you and your family can do at the moment to protect yourself. If you cannot wash your hands frequently when you're out and about, hand sanitizers like this one right here are great. It's just a cap, it sprays. There's a spray in here, you spray it on your hands. You want to make sure that you get between the fingers and the back of the hands. We've talked about this many times, but this is really, really important. So I really need people to pay attention to that. If you are sick, if you have a cough and a respiratory illness, and maybe if you've had a travel history or you think you might have been exposed, then certainly you want to isolate yourself and you want to call your healthcare provider, whoever that is. And as the county executive said, the best thing is please do not just show up at a facility and say, I think I might have coronavirus, because they need to be prepared to receive you. People need to be able to, we need to protect our healthcare providers. We certainly don't need them getting sick. So they need to be forewarned so that they can be ready to receive you. Individuals who have been exposed potentially, we will be quarantining them. We will be placing them under 14 days of observation to ensure that they do not become ill. And if they do, they will be properly tested. And if required, they would be provided, medical care. So I think the basic things that we've talked about all before. I've asked everyone, please get your flu shot. County executive was a great example of doing that. He did that because...
Great example of not doing it.
Well, he did it when he was asked, and when the cards were down, he did it. So I'm really asking people, please do, if you haven't got your flu shot yet, please do get that, because that can take those symptoms off. So when you call me and you say, I have a cough, I have a cold, could I have coronavirus, I have a fever, my first question is going to be, did you have a flu shot? And have you been tested for influenza? Because maybe that is still the most likely thing that you might have. So I guess, that we will be coming back to update you more as I have more information. And like I said, I've only known about this since 1 o'clock this morning. So we're gathering information, and we certainly will be sharing that information as we know more. So thank you.
I mentioned before about our partners in government. Mayor Noam Bramson is the chief executive of the city of New Rochelle, which is the second largest city in Westchester County. And this is the home community of the individual that has the active case. I think it's important to understand that these cases can come from anywhere. It's a matter of chance by which a particular community may have an active case. And I think we have to be prepared that there'll be other active cases, and they may find themselves in different corners of the county. They may not be connected directly to travel to China, South Korea, Iran, or Italy, the countries that have been identified. And that puts more burden on local governments, the police force of the local governments, any of the responsive services, emergency services that happen. So I was in contact this morning. Ken Jenkins was in contact with the mayor very early once we understood what we were dealing with. He and his team have been very responsive. He spent the morning with us here, and we expect to be coordinating on this particular issue in the days to come. But again, Mayor Bramson, we thank you for your partnership, and we'd like you to share your thoughts.
Well, first I want to thank the county executive and Dr. Amler for their outstanding leadership and for their coordination throughout. It's very reassuring to me as a municipal official to know that we have such strong and effective partners in government. They were so comprehensive that it permits me to be very brief. First and foremost, I know that I speak for every resident of New Rochelle, particularly members of a close-knit faith community, when I say that our thoughts and prayers are with one of our neighbors who is ill. And we are thinking also, of course, of his family and friends and wishing them well. This is a moment when I think all of us in government need to be able to speak with clarity and consistency. And so considering that New Rochelle, like every city in Westchester County, does not have its own public health apparatus, the best thing we can do is take direction from experts at the county level, at the state level, and make sure that we are coordinating to whatever degree is recommended by Dr. Amler and her colleagues. We have already done so this morning. We will continue doing so going forward as long as conditions warrant. The last thing I will say is that we have seen in recent weeks, as concern about coronavirus has spread, that whole communities have been profiled and ostracized. We are so grateful in New Rochelle to be home to people of every tradition and circumstance and faith. That is something we are proudest of. We have a large Jewish community. We have a large Orthodox community. And this is a moment when all of us need to come together and be supportive of our neighbors. And as the county executive said so eloquently, as the governor reminded us this morning, it is a time for appropriate focus and concern that does not stray over into unjustified panic, which is only self-defeating. And I have every confidence that the people of New Rochelle and the people of Westchester will strike that balance well.
Just as we get ready to go to questions, I just want to summarize by saying we expect to be giving you regular updates the general statistics about how many people are being quarantined. We have one active case. We hope we don't have to report that there are more. And then certainly the health status of those individuals are part of what we intend to report on. Catherine Chaffee, our terrific Director of Communications, will be in touch with the media the traditional ways. We'll try to give you statistics in real time. You know, there won't be hourly updates, but they will be periodic enough for you to know what's going on here. And for some of you that cover other, jurisdictions around us, you'll have other information that you'll have to put together. But if there are any inquiries, any stories that get out there, Catherine and her communications team that are all throughout here will help. Emily Saltzman, our Deputy Director of Operations, is with us here today. Joan McDonald, our Director of Operations, is out of the county today, but Joan and Emily and Susan Spear, the rest of the operations team that's represented here, all of the commissioners, are working as a singular unit across those dotted lines of different departments. As I said, different resources in Department A or B are being identified and channeled to assist Charlita in this detective work of finding out who are the people that this particular case came in contact with. And that will be what we will have to do as a county health department with every single case. If we wind up with another case or 5 cases, whatever comes our way, we're going to have to be able to provide that detective work. And so this issue is far from over. As I said, the last time we were together, only a fool would say it's under control. We were managing it within the parameters of our skills and abilities and manpower, but we are dedicated to trying to deal with it. And I would say one final thing before we go to questions. I am fundamentally an optimistic person. This is a sobering moment. Our demeanor is not pleasant and jovial. Yesterday we had a nice press conference to announce the Section 1 basketball tournament, and that was a fun press opportunity, and those games are going on, and we hope that you feel comfortable in going to see them because your health isn't impaired at this stage of the game. But our soberness of demeanor does not underlie a pessimistic attitude. We are optimistic people. We believe that intelligent people working hard and with a little luck, we will deal with this problem effectively. Governor Cuomo said as much in his earlier press conference. He has had a decade of experience as governor of this state, and he has seen other outbreaks over the years during his tenure, most recently the measles outbreak that affected more heavily Rockland and Brooklyn. And we have come through with it. We have come through it before. We will come through it again. We will do it by working together and by being realistic about the level of the challenges we face. And I appreciate the fact that my colleagues in elective office are here as well. They are the eyes and ears in each of the different communities because they're going in every nook and cranny of community areas, and they perform an important communication role in this as well, as do our state legislators and federal legislators. So with that, I'm going to stop, open it up for questions. Tony Aiello put his hand up just like that, so we'll go to Tony.
I could ask Dr. Amler, obviously many unknowables, but we have seen, for instance, the swine flu in 2009, and you do have the advantage of several weeks of watching how this played out in other parts of the world. So, can you help us set our expectations based on what we do know? Are we likely to see a handful of confirmed cases in Westchester, dozens of confirmed cases, hundreds of confirmed cases?
Well, right now it's a little early for me to say because I don't know how many people this individual potentially exposed to the infection. And so hopefully over the next few days I'll have more information about that. But I would say in general, we are seeing cases across the country. So, I do anticipate that we could see more cases. But it would just be, I think, irresponsible of me to try to give you numbers that I have nothing to base the facts on.
And you referenced further contagion based on this one man, but it's entirely possible that other people who had no contact with this man could come down with the coronavirus as well, correct?
Well, I mean, I'm sure you've been watching and you know what's going on in the rest of the world. So, there have been a major number of cases in Iran, South Korea, Italy, Japan. So certainly we have residents who travel to these locations and return. So I think that we constantly have to be vigilant.
And Tony, I think it's a fair expectation that the number of cases will grow. Westchester County is adjacent to New York City. In round numbers, 200,000 of our residents in a county of 1 million people, we hope, census will prove that, 200,000 people so commute every day out of this county to work. So we are not in a more rural setting. We are not separated by, some sort of barriers of mountains or lakes or waters from other interaction. We have international corporations that are based here. They do international business all over the world, and individuals that don't work for those corporations but meet with those corporations travel in and out of not just the world but across the country. And we're seeing an outbreak in Washington State, and we don't know where else this will apply. I think we have to assume that this contagion will grow. And I think part of what our planning is, I alluded to it before, every department in the county government is planning on what happens if we move to the next level and to the next level after that. We're not going to jump ahead to those actions, nor are we going to speculate about it because it's irresponsible. But understand that we know that if this contagion grows, we will have to take more significant actions. That's why the governor and the state legislative leaders, Andre Stewart-Cousins, Carl Hastie, and their allocation of $40 million is so helpful, because we don't know yet what kind of expenditures we're going to have. We talk about that all the time between the legislature and the executive branch, and we have a budget, and something like this could bust a budget just on its own because of the manpower and the efforts. We don't know. So we hope that the money that's available from the state will help us get through those things. But I expect it to grow. I'm not a professional. Logic tells me that this will grow, and we're going to have to be prepared to deal with a larger number of people that will both need to be quarantined. And keeping the language correct, if you come down with the disease, then you are isolated. That's a separate thing. And see, I read my talking points. Yes. And that is where we start to deal with the state and their superior authority because of the interaction of Westchester people with being in Connecticut, being in New Jersey, being in the Hudson Valley, being in Manhattan and the Bronx and so forth. So,
sir, do you have any doubt that you're going to have adequate?
And we have been watching Westchester County Executive George Latimer alongside health officials providing an update on the second confirmed case of the coronavirus in New York. Officials say the man is 50 years old, lives in New Rochelle, and works as a lawyer in Manhattan. He is said to have an underlying respiratory condition and remains hospitalized in a New York City hospital in serious condition. Officials say the man's family, including 2 children, are being tested. One of them attended SAR Academy in Riverdale. That school is now voluntarily closed today to determine if children were exposed. Officials say he had not traveled internationally, but did travel to Miami. Experts are now tracking all of his previous movements. And also announced this morning, Governor Cuomo approved a $40 million emergency management authorization dedicated to coronavirus response. And we will continue to follow this story and provide the very latest updates right here on CBSN New York and on our website, cbsnewyork.com.